Good afternoon. It's really my great privilege to be here today with all of you to talk about these very important issues. And when you think about the psychosocial and you're trying to figure out how do we get inside the brain of our cancer patients, I start to think about the fact that there is no apt metaphor for cancer or having cancer or surviving cancer. You know, we talked earlier about being a survivor or fight or coming up with that new terminology. There's also no apt catchphrase. Fighting cancer, cancer warrior, save the tatas, fight like a girl. None of those phrases resonated with me, and even more troubling, to me, you know, if you're not a survivor, it implies that you didn't fight hard enough, and that's not okay. For me, the word I used the most was journey, and even that's not quite right, because for me it was that pre-vacation angst that, am I going to oversleep? Did I pack everything? Am I going to get stuck in security? Is my plane going to be on time? Am I going to have a 9-hour layover and have to get in my car to drive to where I'm going? All of that, cancer for me was 6+ months of planning and fretting and waiting and never getting to that part of the vacation where you actually get to relax. And then, of course, there's that catch-all phrase of the new normal. And while I will concede that based on the definitions of the terms that it could be considered accurate, but I would argue that a new alternate reality might be more apropos in terms of meaning and feel, because this new normal comes with weight gain and fatigue and different hair and a brain that doesn't quite work the way that it once did. But I'm getting a little bit ahead of myself. What I wanted most of all after diagnosis was to return to my boring life, or my life that was just exciting enough for me. I am a breast cancer survivor. I am also the daughter, niece, and second cousin of 3 survivors. I am also an educator and lifelong student, lover of art, human to a 9-pound dog named Ella Jane, a photographer, mentor, occasional satirist, sister, aunt, friend, and hopeful humanitarian. I have served on faculty at a medical school. I've worked extensively in the fields of cultural and linguistic competency, and I continue to work in the fields of health equity, trying to make things better for all of us. All of these lenses will be present throughout my presentation today. Now, a few overarching things before I begin, and I will go into detail as we go through this afternoon's presentations. Number one, well, first of all, if you only remember a few things from my presentation, these are the ones that I would like you to take away. 1, psychosocial wellness in survivorship starts with psychosocial wellness in screening, in diagnosis, and treatment. In order to integrate psychosocial care across the continuum, we must be explicit, we must be intentional. Our visits and cancer care and services cannot elicit or cause psychosocial distress any more than you might already anticipate. 4, as we talk about survivorship today, tomorrow, and going forward, we would be remiss if we didn't think about the disparities that exist in getting to become a survivor. And 5, any care and services that we offer, any policies or procedures that we recommend must be culturally and linguistically appropriate and must take the patient and family into account. So now that I've addressed what I would like you to remember, I'll talk a little bit about what I was asked to actually talk about. Do I think my psychosocial needs were met? Was that aspect of my care well managed? And if yes, how? And if no, why? Is psychosocial care important to comprehensive care? And how might we better convey the importance of psychosocial well-being to our cancer survivors and patients and their families? So do I think that my psychosocial needs were met? The short answer is yes. Overall, I was very happy with how my care was taken care of. I think my physical care in particular was very well coordinated. But I can also say that I do not think that the fact that my psychosocial needs were met was based on the efforts put forth by my healthcare team, but rather based on my own intent and my own self-guidance. At the time I was diagnosed, my work had me looking at health as a combination of the physical, physical, mental, spiritual, and social well-being, and understanding the intersection of all of those parts. And I fundamentally understood that I would need to have all 4 levels of wellness in those areas if I was going to achieve my desired outcome. All of the health decisions I have made and continue to make look at the intersection of these 4 areas and consider the implications of each of them. This interrelationship, this connecting of dots between the parts is where I see the biggest gap and therefore the largest opportunity to providing comprehensive care. The fact that depression and anxiety impact, and we've talked about this already today, the fact that depression and anxiety impact the way that we feel, impacts our fatigue, impacts our ability to sleep, our social functioning, all of those pieces are well documented in the literature. However, I'm not convinced that they're well communicated to the patient. Each physical aspect of our care impacts the psychosocial and vice versa. It is important for us to remember in the context of this conversation that your psychosocial well-being implicates how you feel, but also indicates if and how you will advocate for yourself and if you will carry through with the treatments that you need. So as I set out on my journey, I first delegated the responsibility of my physical health to my healthcare team. I set out and chose doctors who were good communicators, who I knew could effectively communicate my care needs to me, but also with each other. I wanted to make sure that everyone was interconnected. And once I had my clinical team in place, I mentally put them in charge of my physical well-being. I knew I still had to manage self-care. I still had to take care of myself, but beating cancer, that was on them. Now, we've talked a lot about this today, so I'll keep this part short, but physical symptoms that had great effect on my psychosocial well-being and still have implications today was chemo brain, the chemotherapy-induced peripheral neuropathy in my feet, and the fatigue. Oh, so much fatigue. Or as how I used to frame it, I used to feel smart. Why does it hurt to walk? And I'm sorry, I can't go out this weekend because I think I have about 4 naps I need to take. For my social health, I turned to my friends, and I made the bold decision early on to share my story widely. I got on social media, and I put it out there. I shared the whole thing. And as someone who had taught physicians on how to break bad news, I found myself as a patient wishing there was a course on how to do the same. I chose to start a blog in order to share my story and also to be able to remember it later on. And my friends and family were amazing. The outpouring, phenomenal. The care packages, the food, the phone calls, the bouquet of unicorns. I mean, if they could do something to make me feel better, they did. And I have never used the words humbled and grateful so much. Now that said, other than the mentioning of support groups or the reference to the Cancer Support Center that was across the hall from my oncology unit, there weren't real discussions about my mental health during my cancer treatment. Now, during my original, at diagnosis and during my original consultations, there was the use of the soft voices and the offering of hand-holding and that sort of support. But at that moment in time, I was ready to put my plan into action. So takeaways number 1 and 2. Psychosocial wellness and survivorship starts during screening, diagnosis, and treatment. And we must be active and intentional in the patient's psychosocial well-being. Communication is hard. Communicating with patients is hard. Having enough time to get to know your patients so that you can communicate properly with them is hard. There will be patients that, like my mother, who wanted to know absolutely nothing. At the time of her diagnosis, and still today, she doesn't know what her stage was, and she doesn't know what her prognosis was. And she went through her entire treatment that way. And then there will be patients such as myself who want to know absolutely everything. We will have done homework, we will come prepared, we will want to talk, and we want to find out what options are best for us. Because I used to teach at a medical school, my kind of default position is education and the patient-provider relationship and how we can make that better. And so, but I'm sensitive to the fact that as I was teaching at this medical school and I was teaching them how to communicate and I was including the aspects of diversity and spirituality, and the med students were looking at me and blinking and saying, but I don't want to be a sociologist. So I'm not suggesting that oncologists become social workers. We're talking about this integrative model. But providers and practices must think that it's important, and they must ask about it explicitly. Don't just ask how we're doing. Ask how we're coping. Ask how we're doing at home. Ask the question in different ways because you're going to get different responses. And as you're working with your patients, help them to figure out what triggers might be to psychosocial distress. For me, to this day, triggers include being routinely reminded about how important mammograms are, despite having a double mastectomy. Seeing pink ribbons everywhere and being consistently reminded of the journey that I went through, and being slightly disturbed that my cancer came with sponsors and research, whereas other people's cancers do not. And then there's the regular life things that happen even though you have cancer. My worst cancer day was the day that I lost my dog, Tessa. There were more than one time when road rage manifested as, I have cancer and my dog just died, so just please get out of my way. There will also be job concerns and financial concerns and fertility concerns and family concerns, just to name a few. So knowing what to do with ourselves and then knowing what to do with ourselves after treatment is over, that's a whole nother issue. When I found out that treatment was over, I had what I called an adrenaline hangover. I had so much energy and angst, and I didn't know what to do with it now. With a calendar suddenly free of doctor's appointments, I was relieved, lost, and tired. Oh, so tired. And as a type A person, I couldn't figure out. I was like, I'm getting enough sleep. Why on earth am I so tired? And then I did the kind of the math, and I said, between August 2013 and August 2014, I was diagnosed. I underwent a double mastectomy and reconstruction. My dog of 12 plus years died. I underwent 16 rounds of chemotherapy. I adopted a new dog because I needed the reminder to giggle and to move again. I got genetic testing to confirm if my family carried the BRCA mutation. We do. I had a prophylactic bilateral salpingo oophorectomy, presented about my patient experience at Stanford, and started menopause. Once I did the math, I kind of got tired. So then I turned my attention to why I felt lost, because I wasn't ready for that. Even though it had only been 6 months after my diagnosis, I felt like yet another part of my identity had been stripped away. I didn't have the things to put on my to-do list anymore. I didn't have the appointments to go to. And all of the friends that had been so omnipresent during my treatment, understandably, took a step back. They all went back to their normal lives, and I was there, fundamentally changed and not knowing what to do about it. So what did I do to help alleviate stress? I am very close to my mom, and she was by my side throughout my journey. And the fact that she had gone through this in the early 1990s and made it through gave me great solace. I walked my dog a lot. I still do. And I turned to my blog as a way to share my story in an effort to help others, but also so that I didn't have to tell the same story again and again and again. I also wrote a manifesto for my cancer-free turning 40 life. and then I tried to live up to it. Takeaway number 3, our visits in cancer care and services cannot and should not induce psychosocial distress in and of themselves. And I have 3 quick anecdotes, 2 of which are mine, one of which is something I heard at a meeting recently, all of which I consider places where care could have been derailed and psychosocial distress induced. So while I was getting my breast MRI, and for those who are not familiar with it, this is what a breast MRI machine is. You lay face down into it. The 2 holes are for what you expect them to be, and you go in face down and then into the machine. Now, what they had done is in the eye line there, they had put some pictures, what I imagine is to create a happy place. And the pictures that they put were of 3 white, happy babies. Now, as a cultural competency person, I'm first to note that I'm in Montgomery County, Maryland, 45% white. And I'm staring at 3 white babies. And then I'm also quick to note that I'm in there as a breast cancer person. And, you know, fertility, especially for a young breast cancer person, is huge. So maybe 3 white babies, not such a happy place. 2, when I was getting my diagnostic mammogram and ultrasound done, the radiologist, while staring at my 2.7 centimeter tumor, turned to me and said, "Yes, there is a tumor. We can biopsy it or monitor it. It's really up to you." And I blinked, and I blinked again, and I said, "Even with my family history?" And he said, "Oh, family history? Tell me a little bit more about that." When you can't have faith in the people who are there to take care of you, there is a great source of distress. And finally, as I said, this anecdote is not mine, but there was a breast cancer patient who also happened to have cerebral palsy, and she was undergoing radiation treatment. And she went in and they had a belt to help secure her to the table. But the clinician noted that her arms were still moving, which is not necessarily surprising with the cerebral palsy diagnosis. Their solution was to bring out the masking tape and taped her to the table. Not culturally appropriate, not ADA compliant, and my guess, the source of great psychosocial distress. Takeaway number 4, as we talk about survivorship today and tomorrow and going forward, we have to remember the disparities that exist. As a white woman, I am more likely to be diagnosed, but that gap is closing. As a white woman, I'm also more likely to live than my African American or Hispanic female counterparts. I was diagnosed with triple negative breast cancer, which is more common among African American women and Hispanic women, and is known to strike earlier, to be more aggressive, and to be more difficult to treat, and my prognosis is still better. I know that these statistics have a profound psychological effect on me, and I can only imagine what they have on those individuals whose race is also a predictor of their mortality. Try to understand why we make the decisions that we do. I chose to have my prophylactic salpingo oophorectomy, or have my ovaries and fallopian tubes removed, for 2 reasons. 1, ovarian cancer scared me more than breast cancer did, because I was afraid I wasn't going to find it in time. And 2, I did it when I did it because I had already met my out-of-pocket costs for chemotherapy. And I said, I don't want to have to pay for more than I have to. Takeaway number 5, any care and services we provide, any policies or procedures we recommend, have to be culturally and linguistically appropriate and have to take the patient and family into account. So where does that leave me? Next month will be 4 years since my diagnosis, so I still have 1 more year of that waiting and hoping for that magical 5-year mark. But I'm more or less back to boring, and so is my mom. And that's where we want everybody to be able to achieve and to get into that place where we're comfortable, where we can survive, and where cancer is something that we did. It's a graduation. But in other words, you know, we're living our lives again, and things are as exciting as we want them to be. So thank you.